Hey guys, this is Dr. Hub. Today we are going to look at the EAC. So EAC is commonly known as the external auditory canal. So in external auditory canal, we need to know that there are two parts. So mainly there is a cartilaginous and the other part being the bony part. So let's dive deep into this. So firstly, we are only focusing on the cartilaginous. So cartilaginous. So in terms of the cartilaginous, we need to know the proportions. So cartilaginous, it forms a lateral 1/3. So it is formed by the lateral 1/3. And what is the length of this cartilaginous part? So the length, if you see, it is 8 mm. So what is this cartilaginous part made of? So it is made of the auricular. It is made of the auricular yellow. So it is made of the auricular yellow elastic cartilage. So it is made of the auricular yellow elastic cartilage. Now what is the direction of this? The direction is, it is upward, it is backward, as well as it is medial. So it moves upward, backward, as well as it moves medially. Next, we are looking at how is the skin. The skin, if you see, it will be thick. It will be thick. The skin is thick. Then what does the skin contain? The skin contains, it contains the hair. So the skin contains, there is hair. Then there is the ceruminous and the pilosebaceous. There is also the pilosebaceous. So hair, ceruminous, pilosebaceous glands, as well as they produce wax, the production of wax. So what is the deficiency? So the deficiency, it lies in the fissures of Santorini. So there is fissures of Santorini. So this was about the cartilaginous. Now let's look at the bony. So looking at bony, the proportion being, it happens in the medial 2/3. So it happens in the medial 2/3. Next is, what is the length of the bony part? So bony is in the medial part and the length is 16 mm. So it is basically, bone is twice that of the cartilaginous, so length is double. Then we look at what is it made of. So the bony is made of, there are bony margins of the temporal bone. So there are bony margins. So there are bony margins and this is of the temporal bone. So bony margins of the temporal bone, and there it is nothing but the squamous part superiorly. So it is made of the squamous part superiorly and also the mastoid part. And next there is mastoid part. This is found posteriorly. So squamous part superiorly and mastoid part which is posteriorly. Now let's look at the direction. So looking at direction, it is downward, forward and medially. So in short, it is DFM. That is, it is downward, it is forward and it is medial. So how is the skin? Looking at the skin is, it is thin, whereas in case of cartilaginous it was thick. Here it is thin and it is continuous over the tympanic membrane. Now let's look at the deficiencies. Under deficiency, it is the foramen of Husky. So it is a foramen of the Husky. So this was about the external auditory canal. We saw differentiated the cartilaginous as well as the bony parts, and we saw few features such as the length, what is it made of, the skin, as well as the deficiencies. To learn and grow daily like this, please do subscribe.